My name's Joy Longley. I'm an adult nurse practitioner, and I have a doctorate in nursing practice, and I also have a focus on health promotion studies. I've been working in healthcare for a long time with specialties in diabetes and cardiology. I started off as a social worker, and this brought me in contact with the healthcare system. And I realized after a short time that I had a good fit with healthcare. So I moved into nursing, and I've just continued to go back to school, and it has been a wonderful career. I'm still very, very excited about what I do. I'm part of the very first wave of nurse practitioners in the late 70s and early 80s, and I've worked in many states in the United States, from New York State to Minnesota to Washington, and have also had an opportunity to work in Canada with First Nations. I've worked on reservations in the United States, and now I'm in New Mexico, which is also exciting. My focus in healthcare has been on chronic disease management because I think it's a very difficult thing to deal with in life, and I think that we need to emphasize the fact that individuals are at the center of the treatment plan, and that all treatment, especially for things like diabetes and heart disease, have to be individualized and need to fit the lifestyle for that individual so that they can actually live a healthy life within the context of their communities. I see patients in this clinic with diabetes, and also can see individuals who have diabetes and heart disease. But my focus definitely is diabetes, both type 1 and type 2, and pre-diabetes as well as metabolic syndrome. I have a particular interest in insulin pump therapy, which offers some wonderful opportunities for people with diabetes. I also have an interest in diabetes and pregnancy, and again have a special interest in diabetes and heart disease. Prediabetes is a condition where insulin is not working properly in the body, and blood sugars can be quite changeable. People sometimes can have symptoms of low blood sugar, and this generally is a precursor to developing actual diabetes. So it's very important to work with individuals during this period so that they can learn some of the important things about eating and activity that will delay the onset of diabetes. Diabetes is a very serious condition for everybody, but it is particularly serious in the Native American population, and its prevalence has increased in that population. I've worked with both First Nation groups in Canada and on reservations in the United States, specifically focusing on chronic disease management, heart disease, and diabetes. And I think it's extremely important that we provide services and education and coordination with Native communities to improve care for their diabetes.